So good afternoon. Today we are seeing about feeding the geriatric patient. So what are the condition we are doing means here? What are the feeding we are giving to the parental? Then we giving for the this IT through the through the IV. So that is what we are going to see here. So normally in hospital, what are the diet we are following and all we can see here. So mainly we have basic nutrition, the carbohydrates, proteins, fats and vitamins and minerals and water. So mainly that what are the content will be there carbohydrate, rice and wheat and ragi and all is there. In root of vegetable, potato and sweet and everything will be there. Then we have milk product have fat, pulses, dals, fresh meats, so nuts and all. Oil items content it will be more fat. Then we have vitamin A, mangoes, orange, papaya, and all we can take. Then vitamin B means wild cereals. So that is and all. It will be product from your infection. Then vitamin C for healing the wound. So we can take the more green item vegetables and all we can take. Vitamin D more exposed to the sunlight. Otherwise we can take for the eggs. Then we have take calcium. It will be bone growth. It will be help. So here we are seeing what are the functions. If you have developmental bones or teeth, then formation of the hemoglobin, then you will then O2 CO2 exhalation will be there, then iodine will be hormone thyroxine, then sodium for that fluid balance, so acid for that improve nerve impulse. So like this function will be there. So what are the balanced diet? So that is nutrient supply and nutrient need, that is a balance. So the balance we can take for the all carbohydrate, fats or protein of what we are taking means your balance will be maintained to the daily life. So what are the heating here and living things means carbohydrate we can take more. mm, Give for the energies for upma chapatis. So any dinner like this we can take it. From vegetable antioxidant it will be there, so it will be prevent some cancer, heart disease and all it will be do it. Then we go for that pulses will be milk and milk product or fresh, it will be meals time we can take. So it will be help your bones to strong. Then egg and red meat and all should be take limited amount. Otherwise it will make for indigestion to the your digestion patterns. So maybe disease and all will be blood pressure and heart disease, cancer, it will lead if you're taking overlit. Then salt and all it will be maintaining your hormone balance and all it will be there. Then sugar and jaggery and all it should be restricted, you should average you can take. Then you can advise for the patient or family members and all. So according to that health and well-being to the balanced diet we can advise. Then we can go for the food safety measures. What are the food safeties? First, food contamination, it's important. So either it will be microorganism, any substance will be causing for the food contaminations. So mainly that causes will be get for typhoid fever, diarrhea, loose motion if you're taking raw vegetables, raw meat and all if you're taking its parasites, roundworm, tapeworm and all it will be get for your immune system. Then measures of promote food safety. What are the measures we can take? So handling of the food item it's important, cleaning of the food items it's important, then eating raw food and storage and all it's before cook until we can have it. Then if your person must should be healthy and free from infection to the cooking site. Then personal hygienic is important. Before handling anything you can wash with your hands with daily bath, or you can dry it, then you can start your procedures. Then we can go for the fruits or vegetables should be washed and wrapped and soaked for the soaked and feeding to the patients. Then washing vegetables is important before cutting. Then never eat cut vegetables, fruit or from outside vendor. Okay, then we have food storage is a maintain. So food store it's not only for the before preparations you should keep, but after preparation you should not keep. So if you have anything open and you should not keep it. Okay, always close and you can preserve. Then what are the dietary modification for the disease condition? We have the types of diet is that. So normal diet, semi-solid diet, soft diet, clear. So clear fluid means any juices, ORS, then we can have give rice water, ganji and all we can give the through the rice tube or through the oral we can start. Then semi-solid means semi-solid diet always prepare for the become soft or mesh water. Then we can have that, we can add some water, dal or vegetables, so everything we can have it, we can mix it, then we can give that semi-solid diet mash. And soft diet means it will be normal diet. So people have dental problem or elder or no food restriction means that people we can give have the soft diet. It will be prepare for your meat, skin, seeds or chopping pieces, cooking pieces, everything it will be there. Mixed vegetable and all will be there. Normal diet means it's a balanced diet. You can take any energy giving food, then bodybuilding foods, protective regulative foods and all we can take it. Then what are the foods, what are the meaning, what are the modification diet will be there. So obesity, so increase the exercise body fats, it's leading to increase your weight. So decrease intake is important, so we can take rice or chapati bread like this we can take. Then increase intake of fibers rich food and all. The diabetes mellitus, so increase the sugar in the blood, it leads obesity, blood glucose level, everything it will be increase. So level of 180 to 20 and all it will be. So we can target about decrease the intake of sugar and everything. So we can have we can take more vegetables and all we can take. What are the restrictions? Banana, mango, choco, sweet potato and all is a restriction. Then hypertension. Hypertension means the high blood pressure, so we can take, we can give the small quantity of amount, we can restrict with the salt limited and alcohol. Then fever is the infections occur in the body, so we can give the increase intake and liquids and all we can give it. Then kidney failure, so kidney failure maybe fail from urines or anything, and they can't maintain the urine and all means that people we have more liquid items, then we can salt restriction, and then limited liquid is we can give it. Then kidney stone means salt particle get collecting to the kidney, so we can restrict meat and meat product pulse. Then we can have beans, spinach, tomato, beetroot, so that is a big element and our vision restricted. Then indigestion, so indigestion is not able to digest for the heartburn anything means plenty of fluid we can advise. Then we can avoid for the kitchen cord and all, we should avoid it. Then gastritis, gut system infection of the lack of appetite, acidity formation, so clear fluid we can give the 24 to 48 hours. Then we can have constipation mean difficult to passage of the hard stools, so plenty of fluid, coconut water, then buttermilk, so lazy and semi solid food and all we can provide it. Then we can go for the diarrhea, so it's a frequent loose motion will be occur, so we can give the ors or glucose. Then so sodium liquids and all we can give sodium liquids or citric liquids and all we can provide. Then hemorrhoids, bleeding at the time of passing stool, so we can have bland diet with only without spices we can give it. Then seriousness level jaundice will be there, so we can control the carbohydrates, then proteins and vitamin B and all, so we can give. Then cholecystitis, it's a internal inflammation of the gallbladder, we can give the low diet and balanced diet, avoid meats and all. Then pancreatitis, inflammation of the pancreas, so high caloric carbohydrates, low fat diet and all we can give. So generally what are the precaution we can take while feeding? So always important, food is the most important to requirement of human beings to maintain the restore the health. So we can have the GCA team members, we can responsibility to the hospitals and on home setup to keep the patient to the comfortable position. Then we can give the feeding to the patients, so it will be because patient maybe it's a helpless time that time, so they can't able to do and all we can provide it. So important, keep preference for the patient according to the patient mind. Hygienic is the most, so we can use for the spoon to handling to everything to give the patient food. So food should not be cold and anything, it should be warm will be there. So encourage the patient eating prescription doctor dietitian advice according to that. So Food survey is a per menu card for some same patient should be verified with the nursing officer or any dietitian and all we can give it. So in case any doubt means anything we can ask for the nursing officers. So what are the general precaution we can take while feeding means food plays most important role to the recovery of the disease. So hygienic is well maintained. Groom also eats properly and dressed to the cloth and everything to who is the survey person. Wash the hands before giving that any food or because free from infection. So serve the food, it will be at least mild temperature. Soft diet we can give it to for easy to digestion. The patient should be explained about the timings and meal everything we can according to the timings we can provide it. Then feed the patient first slowly, then tell them to allow to choking and swallowing and give water between in between. Then we have that most liquid or semi-solid means we can go for the fruits or soup anything we can give. If your patient difficult to drinking means we can have straw anything we can give. Then depending upon the patient condition rice tube if your rice tube, otherwise oral therapy we can give. So if your patient are unconscious we can go for that rice tube only. Then what are the observation reporting of the unusual findings? So food serve patient means if they like or not. So patient is finished for food service totally left in between. Then in case unconscious patient they're uncomfortable then difficult to breathing or coughing anything means immediately we should stop. Then food might be entered to the one cup. So it will be go inside means they can immediately inform to the nursing officer because aspirated the food it will be respiratory tract. Then commonly we can have recordization for food intake. So because in stomach, if you're not that having burning sensation, acidity and all, it will be that necessary can be take for the patient time also. Then important note the timings of the when the patient is had then abnormal anything happen after food. So that is another we should check. You can indigestion or overeating means undereating means patient with necessary action doctor needs to carry out. So this is they can ask only for that questions. What are the types of diet we are using that they will ask. What is the balanced diet question it will come. So you can write it for that normal diet, semi-solid diet and solid diet. So this unit only will question for that one only. So thank you to all.